In this episode, I decided to rant about the absurdity that are treatments that promise instant pain relief. I keep it short and simple with why those treatments are dangerous for the client and using them will make the problem worse. I hope you enjoy my rant and possibly change your perspectives on the nonsense that comes from treatments promising instant pain relief. Welcome back to the Soft Tissue Treatment Revolution podcast, where we teach overworked massage therapists a new treatment system that will allow you to double your income, all while working 50% less, so you can avoid that dreaded burnout, stay healthy, and help more people get out of pain for good. If you're new to the show and you have no idea who I am, my name is Dr. Matt Maggio. I am a soft tissue injury treatment expert specifically for neck, shoulder, sciatica, and hip pain. My focus is on finding and fixing adhesion, also known as scar tissue, and reducing inflammation from chronic injuries without the use of drugs, injections, or surgeries, which does lead to a significant increase in overall functioning, flexibility, and long-lasting pain relief. Thanks so much for stopping by and checking out the show. Let's get right into it. Instant pain relief treatments. I put treatments in parentheses because they're not really treatments. They're dangerous. So why did I make this episode and decide to rant? Over the past couple months, I've had a new intern in my clinic that's fresh out of massage school, learning everything, questioning everything, asking me lots of questions. And they love to scroll the Instagram and the YouTube and see all these therapists out there talking about their amazing treatments and instant pain relief and, can fix a problem in 2 seconds and the greatest thing on earth and all this shit. So they're always asking me questions if these treatments are legit, are bullshit. And I'm here to tell you, something that promises to instantly get rid of pain is complete bullshit. So the question we must ask ourselves is, why do we have pain in the first place? Why is evolutionary pain built into us? It's to alert us that something is wrong and we need to pay attention. It's getting our attention. That's what it's doing. That's what pain is there for. It gives us an idea that shit's about to hit the fan and we should probably listen. We also got to understand the components of injuries and pain presentation. So I talk about there's 4 parts to an injury that we look at. One is going to be the tissue, one's going to be the structure, one's going to be their metabolic health, and another one's going to be just their mental health, of how they're perceiving the pain, how they're thinking about the pain, all of that. We make a lot of mistakes as soft tissue providers, and I did this myself for years, of thinking that everything is specifically a tissue problem. And what I consider tissue problems is the fascia, the ligaments, nerve entrapments, and soft tissue dysfunction. But not all injury presentations are solely just soft tissue problems. There's also structural problems that are involved in the injury. The structures that I consider are bone, cartilage, disc, and tendon. Now, the soft tissue problem in most cases is what starts the problem in the structure of the bone, cartilage, and disc and tendon. But a lot of times, if there's just a soft tissue dysfunction, the symptoms and pain level will not be high enough for the client to notice all the time. And if it's not high enough, they're probably not going to make an appointment to come in your office. So a lot of times what happens as that soft tissue builds up, more problems occur in there. I talk about the adhesion. It's like glue that gets inside the muscles, the nerves, the ligaments, makes the muscles less flexible, weaker. It in turn puts more pressure on the bone, cartilage, disc, and tendon, and that's where damage starts to happen. That's when people get a lot of pain and they come in and they make an appointment to get their problem fixed. There's this idea in the body in a system called protective tension. Basically what it is your body and the nervous system really winds down or ramps up to try to unload areas of dysfunction. And most of the time it's usually in that bone, cartilage, disc, and tendon, or possibly a nerve entrapment as well. So what happens is certain imbalances, maybe one hip's higher than the other, one shoulder's higher than the other, or something's rotated forward, or something's not firing. It's done for a reason, because it's trying to unload that tissue. It's the same thing when you sprain your ankle, your body knows to limp. Your nervous system is protecting that area to allow it to not get loaded anymore, because if it gets loaded even more, it's going to produce a lot of problems and you're going to have bigger problems down the road. So how do these so-called magic treatments, that give instant pain results right away, You know, I've read some of their websites and I'm just like, man, I'm dumber from reading this shit. You guys are fucking retarded. This is dumb. But they're out there, and there's lots of providers out there that say they can provide instant pain relief. And that sounds great to the client, but it's all bullshit. What they do is they actually play a trick on the nervous system. So anytime you stimulate an area, maybe muscle, a nerve, whatever, maybe you do a stretch, maybe do an exercise, do some type of trick. What it does is it temporarily allows that pain to reduce. When it does that, it increases these things called mechanoreceptors, which sense movement. And they travel in the same part of the spinal cord called the lateral spinal thalamic tract. And basically what happens is when they stimulate this area, it blocks all that pain. And the client feels great. They're like, holy shit, this is the best I've ever felt in my fucking life. You're amazing. You're a magician. And the provider's like, yeah, I'm the best. Yeah, this is the coolest shit ever. I am changing the world. The client's moving around, the best they've ever moved. They're like, this is amazing. It's feeling great. But they just played a temporary trick. It just temporarily shut off that protective loop because you trick the brain, you trick the nervous system. The results of that pain relief are temporary at best. There's a big danger of improving only symptoms, but not function. I always say any treatment that improves symptoms only, but does not improve function is dangerous. One example of that is getting a cortisone shot. It gets rid of pain, but it doesn't improve anything. Another one is doing these neuro tricks where you get the nerves going, you get them firing, and then all of a sudden they feel great. They don't have that pain anymore. You're just tricking the brain. I always say that the pain is like the body's check engine light that came on. It's like, hey, there is a problem here. These type of treatments that, pride themselves or, say they're going to give instant pain relief. It's like you just unhook the check engine light, but you didn't fix anything. That problem's going to be worse down the road. And you're going to have to deal with it. So why is this dangerous for clients? So when the client feels better right away, they assume it's better. They're like, well, I don't have that pain anymore, so it must be better. And then what they do is they go and load that area even more because they don't have that feedback anymore of that protective tension to take it off of there. And they're like, shit, I can do more. And then what happens is they end up loading that bone, that cartilage, that disc, that tendon, and cause more damage, and it causes more problems. I'm going to try to play devil's advocate here and answer the question, is there ever a time to use these type of treatments with instant pain relief where you play some tricks on the nervous system? I say possibly in like an acute flare-up where they're in a lot of pain and you're really just trying to help lower their pain so they can just feel better. But you have to have them understand that they need to fully rest and not go back to doing the same stupid shit again that got them here in the first place. What happens is people do these neuro-based treatments, they trick the nervous system, and then the client feels better and they go out and do a bunch of shit, and then they're right back to where they were, and they're a lot worse. So I have a criteria that I use. I actually got this from the FDA, the Food and Drug Administration, how they decide if something is a worthy treatment or a worthy option. If it's worth a damn. Number one, is it safe? Number two, is it effective? Number three, is it durable? Now, safe, most of the stuff that we do as manual therapists, it's pretty safe. We're not like doing surgeries or exposing them to chemicals or drugs. So most things are safe in that sense. Effective, it depends what you're trying to do. If you're getting rid of just the pain, yeah, those are really effective. If you're trying to get them functioning better, that's effective. The key here where everybody misses out, I say 99% of treatment methods out there, is it durable? What does that mean? Is it long lasting? Can I make a change in the tissue and then see a day later, 2 days later, a week later, 2 weeks later, that change continues to hold? That's letting me know that we have a durable treatment that's actually doing something. So if it's not a definite for all three of those, safe, effective, and durable, then it's not a treatment and you should stop doing it. So that's all I got for on this rant. Understand that there are no free passes when it comes to the body and biological stuff and just getting rid of symptoms but not actually doing anything. You must make a change in the tissue. You must improve function in order for symptoms to improve. And that's what I tell my clients. I was like, we're going to get you moving better so eventually you can feel better. Anyone can make you feel better temporarily. You can take a pill, you can get an injection, you can do some trick, some stretch, but we're not actually fixing the problem. And we always have a window of opportunity to get quality hands-on soft tissue treatment in there and make a difference. But if you keep dicking around with all these tricks and all these things, always chasing that symptom and that pain, you're never going to get real results for your clients. That's all I got for you guys. Appreciate you listening. As I close every podcast, get out there and be great this week. The world needs access to your quality soft tissue treatment so they can stay the hell away from pain pills, injections, and surgeries, which only make things worse and destroy people's lives. I appreciate you listening, and we'll catch you on the next one. Bye. Thanks so much for listening. If you want help on the path to being able to double your income, all while working 50% less and being taken seriously as a healthcare provider, I have some great resources for you. Number one, get access to our free training modules and introduction to my system, the Peak Method. Number two, subscribe to our YouTube channel, The Soft Tissue Revolution. Links to all of this can be found in the show notes. Lastly, if you like the show, please leave us a 5-star review and share it with others that you know it could help.